G'day, it is Brian. It is the Art of Startup War. You all know what we do here. We are investors. We are not promoters. We are people who put our money into early stage companies because we believe very much that these companies are going to do incredible things. The ultimate objective is that they can grow to build a unicorn. That is what we all hope. But our minimum expectation is that the company can bring in a massive multiple. Now, if we are lucky, every now and again, we get to invest in a company that is making a massive impact in the world. And this company that you're going to hear about today, Nicolette, is exactly that company. It is truly beautiful what they are doing. And as someone who has brought a little boy into this world, he's not so little anymore actually, into this world, I know all of the challenges and the complications and the difficulties and the worries of young parents when they're actually going through that process. So you're going to find out about something that you're really going to want to know about. Investors, you're going to see a product that we believe has the ability to scale because it is so needed. It is not just needed by the consumers, by the parents, but it's needed by the hospitals and by the health institutions as well. And we're not just talking about an idea here, something where it can make the world a better place. We're talking about an implementation which is so close in many ways and will continue to get better and better. So without further ado, I would like to welcome Phil to the show. Hello, Phil.
Hello, Brian. Good to see you.
You and I are new friends, and I could not be happier that we have made an investment into your company. It's going to be fantastic as we grow this. Can you tell us, when we go through the show here, as I said, most of the folks who are listening are investors, and most of those investors really want to understand how you grow the company from where it is today all the way to those dizzy heights where we get in a number of years' time. But before we get to that, I would like to talk about how you came up with this and also what the significance to you is, and really just bring us to the genesis of the story so we can understand a little bit more about the product.
Yeah, absolutely. So we're a digital health company. What we do is empower patients with their own data by turning it into useful tools for them. Today, that's very difficult for them to do. Their data is largely trapped and not useful for them. So that's what we do. How we started, I wasn't in healthcare at the beginning of this. I worked for Canon, the big $50 billion global conglomerate. I had some healthcare customers, but what I did was run an outsourcing division for them.
Yeah. The beast. You worked for the beast.
Yeah. Could not be more different than what we do now. But I had twins, premature twins, 25 weekers. Wow. They were 3.5 months early. So that's what happened. That's the true genesis of the company. I went from someone who was a very confident guy, who was used to making big decisions, and if I was wrong, I'd get fired. I was a VP at Canon, so and I liked it. I was super confident in myself and really good with data and uneasy situations. I just thrived on that. This situation just brought me right down to the ground.
Of course,
I was helpless. For the first time in my life, I knew what it meant to be helpless.
Yeah.
Because there's, with a 25-week baby, first of all, they were 1.5 pounds. Wow. A little under 1.5 pounds each. So super tiny, very, very sick. When a baby's born that early, everything's wrong. Lungs aren't working. They can't breathe on their own. Brain's not developed. It's exposed to lots of different ways it can be damaged. Heart, tons of potential issues there. Infections, all kinds of other genetic issues that are possibilities that you have to pay attention to. That's one part. The other part is you as a parent, if you're in that situation, like I was, we're asked to make decisions. And a lot of times the deadline was like 24 hours. Do you want to proceed with medicine or surgery for this heart issue that your baby has?
Wow.
Let us know tomorrow. I was so struck by the fact that in the NICU, there was no shortage of amazing medical devices that would keep a baby alive and give it a chance to survive and thrive. And yet there were no success tools for me as a parent to navigate the journey. So I made decisions I would do differently. I signed consents I didn't understand. And I missed a lot of opportunities to be a hands-on participant in their care, which that's the helplessness part, Brian. I mean, I couldn't impact positively their outcome. That's the worst feeling.
Yeah.
In the world I inhabited professionally at Canon, we gave our customers success tools that helped them use the services we provided
Yeah.
to great effect.
And Phil, as I think about this, we would all be exactly the same. Like, I would be no different. I would be in the hospital. I would be looking. I would say, these people know what they're doing. I hope. I have no idea, no consciousness, no ability. And if I try and interfere and do something, then the probability is that I'm going to make things more difficult, which is actually the worst thing to do. But it's not. Listen, it's not just. It would be any of us. We would be exactly the same.
That's right. I mean, that's true. And it goes way beyond babies, as we'll talk about later, I'm sure. In most aspects of healthcare today, people generally feel pretty helpless about their own healthcare if they're in an acute situation or have a bad chronic disease, and their families feel the same way. It's very hard to advocate for your loved one. And so for some reason, well, the reasons are pretty well known, but healthcare is behind the times when it comes to thinking about the customer and serving the customer. Patients are customers, yet the investment in the patient experience and tools just for patients is pretty low. Most investment and time spent by hospitals or even in venture capital to date has been around administrative tools, clinical tools, medical devices, those types of things. The biggest area to address in healthcare is making the patients better at being patients, helping them be more successful. Just like in every other industry where you have customer success tools that make the customer more successful, healthcare's got that opportunity. It's the most addressable thing that healthcare can do to get better. So that's what drove me. I've wanted to one day be an entrepreneur for a long time, but this experience was just such a transformer for me that really showed me how vulnerable all of us are in this situation, that I was totally naive to beforehand. So this company did not come about because of an intellectual exercise. It's not because a bunch of super smart people got together and thought it out in a conference room. It's just because I lived this harrowing experience. I am process oriented, I'm data oriented, and I just could see how technology can turn parents from being helpless into members of the NICU team, productive members of the NICU team. And then further, the same principles can apply to many things in healthcare. So, with my kids, my daughter, Nico, her name was Nicolette, she died on day 27. There were some things I raised at the first hospital they were at, which is where they were born, that were sort of ignored. And I just didn't have the confidence in myself to continue to press something that I thought was important, that I think might have saved her, and then my son is 7 now and doing great. And he exceeded expectations. Now, he was still in the NICU for 110 days. And in that 110 days, there were still all kinds of things I could have done better. And so when I got home with him and started to just feel a little bit more normal, a little less delirious, what remained was this just drive to fix this issue. I couldn't, my meetings at Canon turned into just me daydreaming. I couldn't tell you what was just said walking out of a meeting because I was thinking about the NICU and empowering patients and how this has to be addressed. I couldn't, I could live with myself if I try and fail. I can't live with myself if I don't try it. It's that situation. So that's how we started the company. I co-founded it with two people who I already knew. One of them was a neonatologist who I met during my kids' journey. And then another one is our head of product, named Seth, who I knew from working with him when he was at Microsoft and Amazon and I was at Canon.
And by the way, sorry, just at that stage, when you brought in your co-founders and you said, I've just gone through this harrowing experience that I never want another human being to go through in their lives. And I've realized something which can add so much value and bring so much more to everything that I could have ever imagined. Did they say to you, this is terribly wrong, I've realized it, I've known it for 20 years and I've been waiting for somebody to do this? Or did they say, oh, I didn't realize that there was such a huge problem here?
So the The latter, I'm sorry, the former is probably most closely aligned. You know, my co-founder, who's a neonatologist, Dr. Michelle McHale, roughly, on the younger end of the spectrum, especially when we started up a few years ago, and so is a tech-forward physician and is also a patient-forward physician. You know, medicine is just still in the early stages of embracing the idea that patients and their experience should be factored into the equation of healthcare at all. Right. So with him, he totally knew. I mean, he was the first person to tell me, because I was begging him for tools like, hey, is there something that will track, like, my son's feeding data? I can't tell if he's getting better or not. Is there something that tracks this, that? I need an analysis on XYZ. And he said, listen, I'll try to help you find something, but if you want something truly like that, you're going to have to build it. He said that to me. So he was aware, like, this is a problem. And, I was the person who kind of came along that I think he needed to just get started on it. It's in digital health, a good pairing is someone with a deep patient experience and a deep clinical experience that can be partnered together. With Seth and product, he's had his own experiences with family and health, certainly not naive to the issue, and also just super strong when it comes to product. And the chemistry that we've had that pre-existed, Nicolette starting, was really strong, building stuff together. So the differences between what we used to do and what we do now is that this is just so much more meaningful.
No, just like, a man driven or a woman driven by extreme purpose to bring right to a world that's wrong is unstoppable. And so for me, it's just such an emotional, wonderful thing to be around. And I can see why, thinking about, whenever I look at any new innovation being brought to the world, I think to myself, is it frictionless innovation or is it disruption, right? Disruption sounds like it's better, but when you have a lot of people fighting you, it becomes tiring, right? Frictionless innovation is definitely easier. And when I think of the stakeholders here, and I think of parents, relations, anybody who has a loved one, there's no friction, right? Everybody wants it. If you said, I'm going to give you a tool that can help you track everything that's going to be happening during one of the most harrowing and difficult and lonely periods that you'll ever have, everybody would say, yes, please, I'll take one. However, would all hospital officials say yes, please, to the patient's relatives being more empowered?
So we hear strong yeses to that all the time. Now, and in fact, 99% of the time, it's a strong yes. Part of that, though, is that the people we talk to, because we're so early, are people who agree with us about what the future of healthcare looks like, which is going to be strongly patient-centric. There are people who we don't talk to so often that we'll call them the laggards, who are, they're still stuck in the past. And the only way they're going to adopt tech like this is when they're forced to by payers or the government, et cetera, which, by the way, is going to happen at some point. So the wave of patient centricity is happening. We view ourselves as being at the front of that. We're certainly not alone. And our early time is being spent with folks who are singing from the same hymn book. The question is, how do you pull it off? No one's, as far as we can tell, no one's good at that yet at a hospital. If you go to a health system, there are plenty that have the right ideas. They're building the right kinds of culture. Pulling it off and executing, it's always way harder to do than the idea part. And a lot of that has to do with budget, with organizational change, with philosophical change. And technology is a component of that type of change. But it's also, when it comes to executing, it's a strong tool to use when it comes to execution. Implementing tech can help change culture. And so we're focused right now. We just landed our first commercial deal last year. It's been operating, they've run a study, and it's been highly successful. We're focused on multiplying that from one to many. So we've gotten our 0 to 1, it works, we're getting paid commercially. And the thing that we're telling the very earliest adopters, 2, 3, 4, 5, 6, 7, 8, 9, 10, is saying this fits in with your current initiatives. Watch how it actually helps you achieve those things, with zero additional bandwidth consumption of your clinical staff or of your administrators. The thing that's unique about what we're doing is that we're building for patients. So the hospital buys the product, but the hospital is providing it to the patient as part of healthcare. It's free to the patient. Here you go. Here's your success tool. The result is patients and their families are more successful. Health outcomes are better. That's what I mean by success.
They have to be. And you know what I love about this podcast is most of the time during the day I'm obsessively driven on growth, or I'm working on trying to make sure we have enough investment for the companies to be able to drive through, or I'm trying to find out how can we fix product fit or branding. And this podcast is just sometimes my chance to really get to know someone on a much deeper level and just think about some of the stuff that you're involved in and you're going through, and all the multiple impacts there. And the more I think about the hospital side of it, the more I imagine that the first reaction is we don't want, for some folks, as you said, the laggards, but we don't want people to necessarily know. But then the more I think more into that, there's no reason why that should be the case. Like, you want people to know the truth. It's a little bit like having a child at school or being at school. Like, you want people to know what's happening, because if you're doing the right thing, then as long as you have a process to let people know you're doing the right thing, everybody feels better about what's happening, right? But if you're not doing the right thing, then you don't want that to be hidden by other people in the organization that you're making mistakes or you're doing wrong. Like, you want everybody involved in the process. It should be absolutely open and transparent. And the more I think about this, like, literally, I don't think there is an industry on the planet that is more closed and untransparent than the hospital space. Now, look, I say this, you and I know, and you much more than me, is that those hospitals are full of love and just incredible people who do phenomenal things that most of us couldn't even fathom on a daily basis. But they're in the Middle Ages when it comes to interaction with the very people that they're trying to empathize with, heal, deal with, and everything else, and keeping it in the dark. And actually, in all of my time and everything I've done, I don't think I've ever been in a situation where such an obvious required solution is at hand, whereby anybody in charge of hospital systems has to say, it's not about, we're worried that like the patient's parents or friends or everything may bother us. They should be, but there should be a process in place for feedback to explain to them what's happening while they're being told the situation in there as well. Like, really, yours is the beginning of the opening of the proverbial kimono so that we can have, for the very first time, a very honest and transparent relationships with the very people who are trying to heal us.
Yeah. So when someone has that thought or objection, that's a clinician, the first thing is, well, if there shouldn't be anything in your notes or in the record that you wouldn't want your patients to see. That we're past that. If they want that, and they should, you should be okay with that. That in and of itself is a virtue.
Yeah.
But a layer above that is your fear about the bad things that can happen if a patient knows too much actually is an unfounded fear.
Yeah.
The opposite occurs. So if you're a clinician who believes that if the patient knows more, they're going to ask so many more questions and take up way too much time, and you don't have time for all this. Well, actually, they ask fewer questions because they're more self-sufficient. And the questions that they do ask are far more valuable because they're much more specific. In the case of like a NICU family, I mean, if they don't have access to NICU board today, they're walking in the morning and going, hey, how did the baby do last night?
Oh, I know.
Well, how do you answer that question if you're a clinician? You can't really answer it very well, especially not in a short amount of time. But if I'm looking at NICU board and I can see my baby's heart, brain, respiratory data, growth data, feeding data, et cetera, I can look and then find something that is interesting to me or bothers me, or I can read the insights that were given to me by the tool, and I can ask a specific question. I can say, why did the baby have a DSAT last night at 11:30? Well, if you're a clinician, you can answer that question really quickly. Yeah, he had a DSAT, but you know what? Self-recovered and was within range the rest of the night. We didn't have to increase oxygen support. That's a
And by the way, it's not even the clinicians that are having to deal with this 90% of the time. It's the poor nurses that are feeding questions which they don't know the answer to, and they then need to go and get in the required people. Whereby if you build an entire process that goes all the way through, it shows what happened, but also then predictive analysis kicks in later on to say the parents or the relations are going to ask, what about this here? So actually, here's the answer. So it will literally all be there. This happened. This is what we did about it. This is why we did it. This is the situation. Thank you very much. Nobody asked, no discussion. Parents are parents, relations, everybody else at ease. Like it really is, to your point, it is not even just a need, it is an absolutely mandatory requirement that everybody should have this, and the hospitals will actually work much better. Okay, I feel like I'm going to use this whole podcast because I'm so incredibly intrigued about the why and what you've done, and so just in awe of everything that you're about, and the fact that you've come up and given up your entire life to save everybody else's. So, and it's beautiful. And for everybody listening here, and when they've had children, going to have children, like everybody wants this to win now. There's no question. Talk to me though about the regulation that you had to go through, the learning. You built a great team. We get this, right? You didn't do it yourself and say, I'm going to learn my way through. You brought in experts with domain expertise who could build it with you. Talk to me a little bit about how did you raise the money to do that? What did you build? What were some of the data points that you were able to measure immediately? And what are some of the data points that you're going to look at in the future? And we're going to look at building this thing to getting it through to becoming a unicorn.
Yeah. Well, in the early days, because we knew so little about starting a venture-backed company, it took a good year to raise $1. So I thought it would take 3 months to raise $1 million. So that tells you how much I knew about raising. But that's what was in our heads in terms of how automatic this is just not something that everyone else gets, especially in healthcare, because it's a difficult industry and so stodgy and resistant to change. VCs can be scared of it. But their concerns are also valid. Like the sales cycles can be totally hairy and long. And the question is, can I cut through that and be one of the few that succeeds? And so what we had to really do is first understand who we should be raising from. And all the no's we were getting from VCs early on were probably good because they weren't the best fit. As we learned more about it, you've got to find your tribe to be successful. Yeah. Our first VC, full-blown VC check, came from Backstage Capital here in LA. Yeah. The first healthcare specific came from a Pasadena healthcare fund called Wavemaker 360. Mm-hmm. And what is it about these funds that they believe in the same thing we do, value-based healthcare that's going to be patient-centric. So when you're talking to someone with the same vision of the future, that's what really helps get it done. So what we did was we ended up just totally bootstrapping and struggling, no paychecks. It was tough, very, very hard first year and a half. But we managed to build a front end that we were able to test with former NICU parents in as budget friendly as a manner as possible. We got feedback that was validating for what we were building, but also tremendously helpful in terms of where we should go next. We eventually went through the Cedars-Sinai Techstars Accelerator. And that was the first time we had actual NICU parents who were currently NICU parents use the demo product. So in terms of testing a product and figuring out if it's going to work, there's levels of validity. Sending out a mock-up to people who used to be NICU parents, that's the first level, that's good, but you got to keep getting more rigorous, right? And so that was the first time we had integrated with a health record and people who were currently in it. When you're in it, you are at your peak anxiety. You're impaired. You can't make decisions very well. You can't learn very well. To get your opinion in that state is very important. And we did that at Cedars. And then when we launched at Children's Orange County, that's the ultimate, right? We're live in a production environment for the first time. Real parents are seeing their real baby's data in real time. And we're getting, in fact, it's not us, it's the hospitals running a study. So this is it. If it works, we've got something and we can move on from here. And if it doesn't, it's dead. So it worked fantastically. They published a study. Their patient experience levels are higher than they've ever been, significantly. They're saving money on length of stay because it's getting shorter. And so now we have this this value proposition that's proven that we can take to other places and grow. And that's what we're going to do now. So the fact that it does what it's supposed to do for the patients and their families, and it saves money, which is a requirement. There's no health system that will buy it just because it's the right thing to do for the patient. We still have to develop a business case. That's very important. Yeah. But there is a great business case, and it's a formula. It can be executed. This is another thing about healthcare, is because it's so immature when it comes to customer centricity. They haven't done the math, for the most part, on how doing something right for the customer translates into greater margins or greater growth. In other industries, I mean, that's, what do you invest in? We put all our, all of our money went back to the customer experience. I mean, that's how you grow and retain customers. In healthcare, so like you didn't have to ask too many questions about a customer investment. About a travel trip, or a marketing expense, sure. But in healthcare, that's new, right? So they need to see the hard numbers. If you look at the proposal that went through Chalk to get the deal signed, to convince them to pay us for this, it's a detailed ROI.
No, it's a phenomenal. Listen, I know Dr. Anthony Chang down there. I know the AI labs down there. They are one of the most progressive hospitals in the world. I love their mindset to change and what they're trying to bring through. But I also know the level of excellence that they have. You get in there, you get a study through there. You've done something very significant. And so what you've done and what you've built from there to now is Spartan. It's truly incredible. What happened? And by the way, the investors, for those folks who don't know those investors, Wavemaker, an incredible investor. I know Kwame over there really well, probably one of the smartest and most diligent people that I know. And so for them to put money into this is incredible. Backstage, probably one of the most heart-centered venture capitalists. Like, you've chosen the people to go on this journey with you extremely carefully. And you can tell. And the team, the people, the investors, the hospitals that you've done the testing in, all of it has been very carefully thought out. Now, what happens next? How much do we need to raise? What does the next 3 years look like? And how do we make sure that every hospital on the planet has this wonderful device inside?
Yeah, well, so to start with our current effort, we are aiming to have 10 signed contracts before the year is over. Okay, we have 1 today. We're close to having 2 more signed soon, and we want 10 signed by the end of the year. We currently have an open convertible note that's furthering that effort. It's a $1.5 million note. About $800K is filled, has already been funded. So we have about $700K of room left there. On the back of the momentum of getting the 10 signed, we want to raise our A in 23, either Q1 or Q2. Yeah. And that'll be a multi-million-dollar raise. Yeah. The point of that raise will be to really to get hundreds of accounts. That's number one, hundreds of NICUs. Number 2 is to begin to scale the product into the other areas. So we're going to scale. The NICU is really the smallest addressable market that we'll ever tackle. We're going to go and be a complete inpatient tool for hospitals. So instead of one department, the NICU, all departments. And so every bed will have a tablet at the bedside with Nico board on it. And at the same time, it'll be available to patients at home. And we'll use that capital to start to scale that way. And then after that, we're going to scale to outpatient and wellness. So it'll just, Nico board will, and the similar products that we build will be on everyone's phone, everyone's tablet. It'll be your superpower as a patient to be an advocate for yourself, to be a successful patient, to manage your chronic issue, your acute issue, to be a participant in your family's issue if you need the help, whether that's a baby, your child, your aging parent, any of those things. And so that's everyone on the planet has that same need. regardless of how healthcare works in their country or whatever. At the end of the day, the patient needs to be empowered. So we look at our market the same way you might look at the Windows, going from DOS to Windows. That democratized computing and made it accessible and empowered people at the consumer level. What we're doing with data is similar to that. So we look at everybody on the planet as our user at some point.
It's incredible. Like, what am I going to say? It's so beautiful and so perfect and so necessary to get done. And what do you see in the timeline of that? Obviously, we get the 10 contracts in straight away. We get that started. That would drive in good multi-revenue from multiple sources. And then we get to the A in 2023. How do you see that timeline of the rollout, hospital by hospital or even bed by bed?
Well, so the implementation is efficient. We've done a good job. The way we've invested our money to date is heavily on product and infrastructure. So we're already built from an infrastructure perspective to scale to 1,000 hospitals, and we wouldn't have to build anything else. We have a cloud-based product that's tenant-based, and it's ready to go. We already meet all of the compliance needs when it comes to high trust, which you have to do. So this is one of the tough things about selling to health systems. To win even your first deal, you have to have the same security and the same infrastructure as a company that's, a $1 billion company, because it's the most sensitive data possible that we're handling. So, but the good news is we've built it, and now we're ready to scale, and we can scale super efficiently because it's built. It's also a bit of a moat. So companies who might try to come up behind us, they would have to cross that same chasm that we did. And so 10 signed this year means we'll have a heavy implementation period in the beginning of 23, but at the same time, we're still selling. And so we will be scaling up our team for customer implementations and support, CRM, and at the same time, still closing new deals. We're also working with payers to land our first reimbursement deal. We hope to have something announced this year on that as well. That will be a big driver of growth in 23 as well, because I guess it's pretty obvious. If it's a cost neutral decision for a health system, it goes from being a slam dunk to just it breaks the backboard. It's just easy. And payers are interested in this for similar reasons. It reduces their cost because length of stay goes down. It reduces their cost because their member becomes part of their team, right? Payers look at how things work today in a clinical setting and say, this is not efficient. There's no one who works at this health system who's trying to manage length of stay. There's no one who's dedicated to reducing readmissions or optimizing the levels of care being provided. That costs us a lot of money. But when they talk to us, they go, oh, wait, cool. We can actually just have the member be the one who does that if they have the right tool. So their incentive is to have a happy member who stays with them, but also helps them reduce costs. And they don't have to pay the member as an employee, but yet they're enlisted as sort of an employee who helps manage those things. So that will help us grow. And, we want to have dozens of contracts signed in 23, and then we're going to start to sign ones outside of the NICU. I'm sorry to say north of 50, and our first really big. So there are a lot of our prospects that are, have 40, 50 hospitals in the health system that we're working on as well. They're hard to win, hard to close, but we will also be closing some of those. And those will be big hits. So, 20 hospitals at once.
It's really funny. As you're talking through this, I'm trying to work out the functionality of building a cult. I'm not thinking of hospital by hospital. I understand you need to go through that, and you're talking about an absolute perfect market penetration plan. But you have such a highly emotional product, and I don't just mean your story. Your story is such a beautiful story, which is aligned with such incredible purpose that everybody will want this to get to the world. I'm actually have just put myself into all of the moms and dads and brothers and sisters and everybody in every hospital. And if you literally walked into any hospital today, anywhere around the world, and walked into their emergency ward and said, hey, I've just got I'm just taking some signatures here to see who here would like to know by the minute what's happening with their relation with the person they love. Just sign here if you care. But by the way, if you don't care, don't sign. Like, everybody's going to sign. So there's a part of me that believes that there is a huge content marketing campaign that is required here, because people, I even think back when my little fella was born, I didn't know anything. And I wouldn't have known to ask anything. And even if I would have, I wouldn't have even known what to say to ask the things I wanted to ask, or that I wasn't disturbing the person. But if I knew that there was the potential to have a device that I can sit here with my phone and I can just be scrolling through to see what's happening in the moment, and it tells me and it empowers me to know, and that allows me then to check online and find out things online and becoming more knowledgeable about things that are affecting my own blood, then for me, that's tremendously important. So as you go through this, I feel personally that one of the areas that I'm going to be working with you really closely in Expert Dojo on is building up this content marketing so we can start to push from both sides. Everything you've suggested is highly logical and is the way to go after the market, but I think we should push from underneath as well. I think we should add a little bit of pressure for all of the people who are at these children's hospitals, who will go in, who if they knew they could get this, and actually in this one case, normally I say it's moms because they're, I don't know, smarter, better, faster. They're more brave with these types of things. But in this case, moms and dads both, right? So I just want to finish this. I want to leave you with the last word by saying I absolutely adore what you're doing. You and I had a brief conversation about this before, and we went through it. I'm privileged to have you in Expert Dojo. We are going to push this thing to the absolute limit. And I personally, I'm going to work with you really closely on this content marketing and how we actually get really big public awareness. So before you even get to the hospital, they're already receiving the petitions from the people to say, we want this, we want this, we want this now. So I'll leave you with the last word. I think everybody listening, my requests are this. Number one, if you're an investor, I don't know, maybe you heard something different, but if you heard what I just heard, then this is a slam dunk investment decision, and you're going to be able to get Phil's details in a couple of seconds. Number two, you might be somebody who knows people in hospitals, preferably people who are at a pretty high level. I would like you to take this as a call to action where you refer over the people in the hospital that you know. I think it would be a great opportunity to start new conversations. And number three, if you're somebody who can help with regards to team, expertise, knowledge, advising on anything level, it'll be very seldom that you will hear of such a worthwhile and important purpose to get behind for a company that will become a major player in the world. There's no doubt in my mind. And just finally, there are all kind of ways to help, even to the point that I just said there, which is putting pressure on hospitals for more transparency and for relations to be able to get fully access to everything. Okay, that's me done. I appreciate you, my friend. I appreciate you being part of the dojo, and you'll get our everything. Finish up with your last comments that you want to share with everybody listening, and also
absolutely. So I can't wait to get started on those exact things and know that we need it. If you're listening and you agree with us about the future of healthcare, that it's going to be patient-centric and tech is the way that's going to happen, hit me up. I'm pretty easy to find. You can get me at phil@nicolette.com. It's NICOLETTE.com. You can hit me on LinkedIn, and we'll get together and take things further.
Wonderful. Again, thank you again. Thank you everybody for listening. Let's get stuck in. Thank you, Phil.